If you have a fever, you need to stay home from work. That is right. A fever automatically is a no-go when it comes to going to work. Guys, we're focusing on going to work today, but that also applies to other situations as well. A fever tells you and tells us that you are sick, and you shouldn't consider going back to work until you've been fever-free for at least 24 hours without needing to use fever-reducing medications. That is medications like acetaminophen or Tylenol or ibuprofen, things like that to help reduce the fever. You can't be on those medications to make your fever lower and still go back to work, okay? Fever is an absolute no-no in terms of going to work. Also, diarrhea, that's right. Especially infectious diarrhea, diarrhea that's caused by an infection that you have, can be very, very contagious. You don't want to go to work with diarrhea. And also, as a family doctor, I also say the same thing goes for something like vomiting. Now, you're probably not going to be able to work with vomiting if you're vomiting because you probably are going to feel so sick you're not going to be able to do it, but that's not a bad thing because I want you home resting if you have diarrhea or vomiting. And I also want to make sure you are not sharing your germs with other people. Also, other symptoms such as things like fatigue, right? You may say, well, fatigue, what does that go with? Well, some conditions such as mononucleosis, other conditions as well. You can be so fatigued that you're not able to concentrate, that you're not able to do your job effectively, or it could actually be a danger for you to be at work. Guys, that matters too. So if you're fatigued or if you're on certain medications that make you not feel right, fatigue, dizzy, etc., medications to treat an illness might be enough to keep you home due to your underlying conditions, etc. But now let's talk about a few specific conditions where there are, in my opinion, some hard and fast rules, okay? The first one is pink eye. Pink eye, guys, pink eye conjunctivitis can be caused by a number of different things, but it can be highly contagious. Viral bacterial conjunctivitis can be so contagious. If you have pink eye, you should not be going to work, okay? In fact, many sources say that you need to be on eye drops to treat your pink eye for at least 24 hours before considering sort of going back. You want to check with your doctor about that. But guys, pink eye, you don't want to go to work. Also, you don't want to be sharing utensils and things like that at home. With most illnesses, you don't want to do that, but especially something like pink eye. The next condition is COVID. We are very familiar with COVID. The reason why I say COVID is if you are sick with COVID, there is very specific rules and regulations about when you can leave isolation. You need to follow the CDC guidelines about when you can leave your home again, when you can go back to work. There are very straightforward, defined rules about that. So if you have COVID, you don't need to be at work until you've met the criteria set out by the CDC for returning to work and leaving isolation. The last thing I'll talk about is the flu as a specific condition. We talked about, fever and how that plays a role, what you should do with fever. The CDC says that if you have the flu, and even if you don't have a fever, you should stay home for at least 4 to 5 days. Some of the reasons for that is, of course, we know that flu is contagious, very contagious it can be. Also, we know that flu is most contagious within the first 3 to 4 days after an illness. You need to stay home if you have the flu, and fever or not, because it is contagious, and you want to be very careful about that. These are just a few conditions. Obviously, if you have other conditions that make it so that you're not able to go to work, you're too sick to work, then that is perfectly valid and fine and fair. These are just a few conditions to get you started. Make sure you're running everything by your doctor. As much as I'd like to be your doctor, I am not. So run everything by your doctor to make sure you find out what you should do. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my channel on YouTube and click the little bell for updates. And also check out my website, drjencaudle.com, for my newsletter, my daily health updates, and all sorts of things. Guys, I'll talk to you soon.